Hi class. Today I am presenting hepatitis A. Hepatitis A is also called infectious hepatitis. It is a liver infection caused by hepatitis A virus. Hepatitis A virus is a biocoronavirus, which is a common cause of hepatitis worldwide. It is transmitted by oral route and non-oral route. The oral route is the most common route of infection, and it happened by ingestion of food, shellfish, or drinking water that is contaminated with the virus. The non-oral route are male homosexual sex, drug use, and blood transfusion. The incubation period of hepatitis A virus is from 2 to 6 weeks. It is self-limited infection with no carrier or chronic state. The acidic environment in the stomach does not affect the virus. Therefore, after reaching the stomach, it ultimately reaches the liver, where the application process starts. The virus replicates in the hepatocyte and then is secreted into the bile to the GI tract. From the GI tract, the virus uses two routes, excreted via feces or transferred to the liver through the enterohepatic cycle until virus neutralization. Before the development of symptoms or biochemical manifestation, the body goes through the prodromal stage, which is 14 to 50 days. In the prodromal stage, the virus replicates in the hepatocyte and is shed in a copious amount in the feces and in the lower concentration in the saliva. In this stage, the patients are asymptomatic and transmit the infection primarily by feces. Following the prodromal period, the symptomatic period starts in about 70% of adult patients and 30% of a children patient. In this period, the liver enzyme the liver enzyme aspirate and alanine aminotransferase increase in the serum. In addition to increase the AST and ALT, the immunoglobulin M increase in a concentration in the serum and saliva, followed by increases in the immunoglobulin G. The anti-HAV immunoglobulin M concentration stays high in the serum for about 6 months, and the anti-HAV immunoglobulin G stays in the serum lifelong to provide immunity against further infection with hepatitis A virus. At this stage, the fecal viral shedding and the viremia reduced markedly. Risk factor: travel to high endemic area, living with asymptomatic school-aged children, consumption of raw fish, drinking contaminated water, male homosexuality, not cleaning hands after using bathroom and before eating, and contact with infected person. The development of a chemical manifestation depends on the patient age. For most children under age of 6 years, the infection is usually asymptomatic, and for most adults, it is symptomatic. The symptoms continue for 2 to 8 weeks. The patient develops sudden onset of fever, malaise, nausea, vomiting, abdominal discomfort, dark urine, jaundice, and hepatomegaly. Some patients might develop pruritus, diarrhea, arthralgia, or skin rash. The outcome of the infection also depends on the patient age. For most children, the outcome is a spontaneous recovery. In adults, 99% can recover spontaneously, but in some cases, which are less than 1%, can develop acute liver failure, and less than 10% can develop extrahepatic complication. Extrahepatic complication, such as acute kidney injury, acalculous cholecystitis, pancreatitis, pleural or pericardial effusion, hemolysis, pure red cell aplasia, acute reactive arthritis, transfermyelitis, and Guillain-Barré syndrome. The liver function test will show a high level of total bilirubin. For the diagnostic test, the liver function test will show a high level of total bilirubin, alkaline phosphatase, and ALT. Detecting serum anti-immunoglobulin M is the diagnostic. Ultrasound also can be performed to detect hepatomegaly. Thank you for watching.